Welcome. In this program, we will be taking a closer look at respiratory syncytial virus, or RSV infections, in young children less than 2 years of age and how to prevent them. Designed for parents and caregivers, this video will describe what RSV is, how to recognize and treat RSV, and explore preventative measures to take to best protect your young children against severe infection. Let's begin. Respiratory syncytial virus, or RSV, is a contagious respiratory virus that usually causes mild cold-like symptoms, but can lead to serious respiratory illness, especially among children less than 2 years of age, adults 65 plus, and people who are immunocompromised. While other children and adults under 60 years of age who contract RSV infection usually have mild symptoms similar to that of a common cold, RSV is most severe in young children and older adults. In children less than 2 years of age, RSV is a major cause of bronchiolitis, an infection of the bronchioles, the small airways in your lungs that can cause serious lung infections requiring hospitalization. RSV is very contagious, and people can spread it to each other in the same way the common cold is spread, by touching droplets containing the virus after someone coughs or sneezes, being close, less than 2 meters apart, to someone with the infection who is coughing or sneezing. After exposure to the virus, it can take up to a week before a person becomes visibly sick. People with RSV infection are usually contagious for up to 8 days and may spread the virus 1 to 2 days before they start showing signs of illness. Children are often exposed to and infected with RSV outside the home, such as in school or daycare centers, and can then transmit the virus to other members of the family. RSV infections occur most commonly during the winter or early spring in Canada. However, during the COVID-19 pandemic, due to public health restrictions and precautions, there were very few RSV infections. With the lessening of precautions during the 2022-2023 fall and winter season, there was a large and early increase of RSV infections that resulted in many hospitalizations of children infected with RSV. RSV is a major cause of bronchiolitis, which is an infection of the bronchioles, or the small lung airways. This infection results in the blockage of the bronchioles, which can cause significant breathing and feeding difficulties in young babies, whose lungs are still developing. Unfortunately, every year many babies develop bronchiolitis, some so severely that they must be admitted to hospital. Symptoms of RSV can vary from person to person and are similar to those of the cold or flu. They include cough, runny nose, wheezing, fever, difficulty breathing, production of large amounts of phlegm, decreased feeding or drinking, a decrease in energy, and irritability. While most RSV symptoms will go away in a few days, seek medical attention if your child has trouble breathing, is not drinking enough fluids, or is experiencing worsening symptoms. Although all children less than 2 years of age are at risk of severe bronchiolitis, the following are at highest risk: babies born prematurely, babies less than 6 months of age, and babies who have chronic or congenital respiratory or heart problems. There is no specific medication to treat RSV infections. Treatment is therefore supportive, which means that RSV symptoms are managed and depends on the severity of the infection. Most infants with RSV bronchiolitis cough and/or wheeze a bit, but in general, they feed well and do not need oxygen therapy or any other treatment. In most cases, young children with RSV can be treated at home as long as they are breathing comfortably, their skin does not look blue, and they are drinking and urinating as usual. Most children get better within a week or two. Also, because bronchiolitis is caused by a virus, antibiotics are not effective. It is important that babies drink enough fluids to prevent dehydration or loss of body fluids. If your baby is having trouble drinking, try to clear nasal congestion gently with a bulb syringe or with saline or saltwater nose drops. It is also important to recognize the signs of dehydration in babies and young children, which include less frequent urination, fewer than 8 wet diapers per day in babies, no tears when crying, dry or sticky mouth, weight loss, and extreme thirst. If your baby has signs of dehydration, you should seek medical care immediately. To help with fever, children older than 6 months can be given over-the-counter acetaminophen or ibuprofen. Remember never to give aspirin or ASA to children. Some babies may experience enough discomfort and difficulty from wheezing and the buildup of phlegm in their airways that they may need extra oxygen, or even the administration of other medications used to treat asthma, known as bronchodilators. Also, if they cannot drink enough, they may require intravenous fluids. One of the most important aspects of treatment is helping these babies get rid of their phlegm, and this often requires hospitalization. Rarely, in very severe cases, some babies are actually placed on respirators to help them breathe. In young children, such as infants and toddlers, bronchiolitis can be serious and may require a visit to a healthcare provider or to the emergency department. Go to an emergency department if your child has trouble breathing, is working hard to breathe, or is breathing faster than normal, has pale skin, has lips that look white or blue, or has any of the following symptoms: fever if your baby is less than 3 months of age, or fever that lasts for more than a few days for older children, very sleepy, difficult to wake, repeated vomiting and unable to keep any liquids down for 8 hours or more, vomiting or diarrhea containing a large amount of blood, signs of dehydration. Here are some tips on how to prevent the spread of RSV and protect your child. Keep your baby at home as much as possible. By doing so, your baby will be less likely to be exposed to RSV. Disinfect surfaces in your home that are touched on a regular basis. Wash your hands often to reduce the spread of germs. Ask others to do the same. Cough or sneeze into your arm or elbow. Continue to breastfeed your baby, as breast milk contains antibodies that help prevent and fight off illness. Don't smoke at home or in the car. While these tips will help prevent RSV infection, currently, the 2 new and effective options available in Canada to help protect infants against RSV infection are a monoclonal antibody medication and vaccination. Let's go over both prevention options. The first preventative option is nirsevimab. Nirsevimab is not a vaccine, but rather a medication containing monoclonal antibodies that can provide temporary protection against severe RSV infection. Monoclonal antibodies are proteins that are developed to act like the antibodies your body produces. Antibodies are proteins your body makes that help get rid of germs, harmful substances that enter your body, such as bacteria and viruses. The monoclonal antibodies in nirsevimab are used to protect against RSV. Specifically, they recognize and target RSV to help prevent severe infection in infants who may become infected with the disease. Nirsevimab is given by injection, preferably at birth, so that infants who are either born during RSV season or who will be experiencing their first RSV season, typically fall and winter in Canada, can be protected as soon as possible. The monoclonal antibodies take effect immediately and offer a high level of protection for approximately 6 months or more following administration. Children under the age of 2 years who are immunocompromised or who have a chronic lung condition can receive another injection of nirsevimab during their second RSV season. The most common side effects after receiving nirsevimab in infants are rash, pain, swelling, or hardness where the injection was given. Importantly, nirsevimab can be administered on the same day or at any time before or after routine childhood vaccines, including the influenza vaccine. The second option is RSV Pre-F. RSV Pre-F is a vaccine administered to people who are between 32 and 36 weeks pregnant. Getting the RSV vaccine allows your body to produce protective proteins called antibodies that specifically target and protect against RSV infection. When you get immunized against RSV during pregnancy, some of these antibodies are passed on to your baby in the womb. These antibodies can help protect your baby against severe RSV effects for up to 6 months after birth. The most common side effects for pregnant people after receiving the RSV Pre-F vaccine are usually mild to moderate and include pain at the injection site, headache, muscle pain, and nausea. RSV Pre-F can be administered with the tetanus, diphtheria, and pertussis vaccines, and the influenza vaccine at the same time. Your healthcare provider or local public health agency will be able to tell you which preventative option is available for free in your province or territory. In provinces and territories where both nirsevimab and the RSV vaccine are available, people who are pregnant will be asked to decide whether they would prefer to receive the RSV vaccine in pregnancy or have nirsevimab administered to their newborn. Talk to your doctor, nurse, pharmacist, midwife, or local public health office about which option will be best for you and your baby. In conclusion, we hope this video helped inform you a little more on how to recognize, treat, and especially prevent RSV infection in children under the age of 2. As we know, RSV infection is usually mild in most people, but can be very dangerous in children under 2 years of age, especially those who are at high risk for bronchiolitis and its complications. And while there are no specific medications to treat RSV, effective preventative options, such as nirsevimab for newborns or the RSV vaccine for pregnant people, are available to best protect your child from severe infection. Talk to your healthcare provider about what the best preventative option is for you. For additional information, fact sheets, and videos on respiratory syncytial virus, visit immunize.ca/RSV.